Hi friends, welcome back to Small Nursing Tutorial. Today we are going to speak about very important topic, that is phototherapy. It is already known by those who are working in NBSU. Next, first, what is phototherapy? What is the purpose, articles, indications, and method of phototherapy, care and observation can be seen in this topic. Okay, coming to the definition of phototherapy, caring for a baby being exposed to ultraviolet light source for prescribed period of time. Next, purpose of the phototherapy. We have to bring down serum bilirubin level to the normal level. We should know about the articles that are fluorescent lamps and fiberoptic pads if available, eye pads, napkin to cover the genitalia for male babies, baby blankets or sheets too. Next, indication of phototherapy. For that, we have to evaluate the serum bilirubin levels. In healthy term babies, it is more than 70 mg per dl. In preterm babies, it is more than 8 mg per dl. That weight is more than 1500 gram. In preterm babies, it is more than 5 mg per dl. Weight is less than 1500 gram. Next, coming to the methods of phototherapy. In this, phototherapy can be delivered in many ways. The most common methods are fluorescent lamps of Billy lights placed over the infant who is usually in an incubator or under a radiant warmer. Second, halogen lamps. Third, fiberoptic phototherapy blanks or pads. So now we know the methods of phototherapy. Coming to the care and observation during phototherapy, which is very important while giving phototherapy. Coming to the points, we have to provide feeding at regular intervals to maintain adequate hydration to the baby. If breastfeeding the mother, we have to encourage her to give demand of the babies. If the baby is hyperthermic, we have to discontinue the phototherapy and keep the baby exposed under fan. When temperature reaches normal, again we have to restart the phototherapy. Next, we have to monitor bilirubin level and other hematological assessment at regular intervals. Next, check the baby at least every hour and we have to see the eye seals remain in place. The infant may be removed from the lights for feeding, diaper changes, blood draw and other general care, but should receive phototherapy for 18 hours every day. If fiberoptic blanket is used, it should be kept next to the baby's skin at all the times. Be sure that the baby does not roll off the blanket. It is not necessary to cover the eyes if blanket alone is used. Next, we have to monitor body temperature at regular intervals. We have to observe the skin for any rashes, dryness and excoriation. We have to feed the baby every 2 to 3 hours because phototherapy causes the baby to lose fluid from the skin and have loose stools. So this may cause dehydration. To prevent that, we have to feed the baby every 2 to 3 hours. Next, it is very important. We have to count the baby's wet diapers and stools. Increase feeding if the baby has less than 6 wet diapers a day or if the urine appears dark. Don't apply oil to the skin of the baby, and also we have to observe for side effects like loosened green stool resulting from increased bile flow and peristalsis. Stool may damage the skin and cause fluid loss. Tanning effect from the light. Bronze baby syndrome, a grayish brown discoloration of skin and urine. Skin rash. Temporary lactose intolerance. These are the side effects of the baby. We have to observe while giving care and during the phototherapy.